Transitioning Youth webinar. So this webinar is brought to you by Prince George's County Public School and the Prince George's Provider Council. My name is Doralee Palamos, and I am the Assistant Supervisor of Secondary Transition here in PGCPS. Our office's goal is to provide information and support to all PGCPS students and their families as they start planning their lives post-high school, whether it be in the area of post-secondary education or training and or employment. We want everyone to know that this session is being recorded. The recorded version of this webinar will be available within 2 business days, and it can be accessed by visiting our Transitioning Youth information site, which is this tinyurl.com/PGCPS Fair. We ask all participants to stay muted to reduce feedback and background noise during the event. Simultaneous interpretation services is provided during the webinar. So we have American Sign Language and of course, Spanish interpreters as well. So how do you access that? If you're on a computer, at the bottom of the screen will be an interpretation globe. Click that globe and then please select Spanish. If you're on a mobile device, at the bottom of the screen, tap the ellipsis icon on the bottom right, tap language interpretation, and then tap Spanish. For pinning the ASL interpreters video, they're listed as ASL interpreters, and we have 2 of them tonight. Make sure you are in gallery view. You can select gallery view from the upper right corner. Click the ASL interpreters video and select the more button or the 3 dots, and then select pin video. If you have any questions during the presentation, please type them in the chat box. We will be moderating the chat, and we will also have time for questions at the end of this webinar. Now, without further ado, I will now turn it over to our guest speaker, Ms. Nicole Sheppard, Transitioning Youth Coordinator from the Developmental Disabilities Administration of the Southern Maryland region. Nicole?
Thank you so much, Doralee, for that introduction. I really appreciate it. Let me go ahead and share my screen so I can get the presentation up for everyone. And we will beginning. Doralee, are you able to see that?
Yes, we can see it.
Okay, so good evening. As Doralee stated, my name is Nicole Sheppard. I am the Transitioning Youth Coordinator for the Southern Maryland Regional Office. So tonight I am here to talk to you about the Developmental Disabilities Administration and kind of give you a brief overview of who we are, our application process, and what services we have to offer. So I will go ahead and get started. First and foremost, I always get asked, I know a lot of parents here, DDA, have you signed up for DDA? And I always get asked, well, like, what is DDA? What do you guys actually do? So we provide funding for people with developmental disability. We also partner with people with developmental disabilities and their family to provide leadership and resources to enable people to fulfill their most living, fulfill their lives. So we are guided by the principle that people with developmental disabilities have the right to direct their lives and services. So that is something that is very important to us. We always want to make sure that the person that is getting the services remains the center of the plan and that we are doing what's best for them. So our application process, as you can see right here, we want you to fill out the application. You can find our application online. I do apologize, you cannot submit it online yet, but we do take that application via email. If you can scan it, we take it by regular mail, and we take it via fax as well. So in the application, once you fill it out, you want to include any kind of supporting documentation you may have. The school's most recent psychological on file, The IEP that you do yearly with your school system, when they give you a copy of that, is very important that you keep that information, and any other medical documentation that you may have from a medical professional stating your loved one's needs or supervision that they may need. What happens is after you turn that application in, we contracted out to do what we call a comprehensive assessment. A comprehensive assessment is going to be in-person interview, but now with the pandemic, we are allowing for that to be done over the phone as well, if that makes you more comfortable. And it's more to get a sense of your loved one or the person who's applying for services. As we know, the same way someone presents on paper may not be the same way they present in person. So we're going to take a combination of both of the in-person interview over the phone interview and what's stated on paper and make the determination. So that comprehensive assessment is completed by a coordinator of community services. We'll get into that a little more later, CCS as we call them. And they have 45 business days to complete that comprehensive assessment and send that to us. Once they send that to us, our eligibility unit at DDA is going to look over the comprehensive assessment and all the documentation, i.e. that psychological, that IEP, medical documentation, and make a determination as to whether the person applying for services meets our criteria. So again, that determination is made by DDA, by the regional office. So I normally get asked, what is our eligibility criteria? So our eligibility criteria, you can look in COMAR. If you look down there in red, COMAR 102212. COMAR are the state regulations for Maryland. And this is what governs us and lets us know what we can and cannot do. So a developmental disability is defined as a physical or mental impairment, but not just mental illness, or it can be a combination of mental and physical impairments. What that means is someone who is solely diagnosed with ADHD would not qualify for our services, but you can have a developmental disability and a physical or mental impairment, but that developmental disability needs to be the underlying issue, and it has to affect you cognitively. So what we look at is someone who has a condition that is more likely to continue forever. We have to show that it had an onset or it started before the age of 22. That is why it is very important that you keep that psychological, that IEP, because normally those have birth dates on it, so we can see the age of when someone was diagnosed with this. Someone who would need the supports or assistance to live independently, and someone who would need the support of a team to help with your services and treatment. So when that application comes in, this is what our eligibility team is looking at to determine whether the person applying for service is eligible or not. So DDA has priority categories. So when you apply, I know a lot of people have probably have heard of the autism waiver. Generally, with the autism waiver, you can call them, or with other places when you apply and they say there's a waiting list, you can normally call them and say, well, where am I on the waiting list? And they can give you a number, 252, you're 152, things like that. So DDA operates based off priority categories. Even though there is a waiting list, it's hard to say what number you are, because depending on what's going on with everyone else who's on the waiting list in the state, your number could change. So there are 3 priority categories that we operate off of with DDA, and these categories are in the order of priority in which applicants receive services. I'm going to start at the bottom because it's generally a little easier to go from the bottom to the top. Generally, about 85 to 90% of our people are in the current request category. That's number 3. This means you need or want services, though health and safety are not immediate needs for you. Category 2 is crisis prevention. These are people who will be in a health or safety crisis within the year, or anyone who has a caregiver 65 or older is automatically put in the crisis prevention category. Crisis resolution. This means you are currently in a crisis or emergency situation. So we're looking at someone who is either being abused in the home, or someone who is abusing someone in the home, someone who's being neglected, or someone who is homeless or on the verge of being homeless in the next 30 days. Those people are in the crisis resolution category. So depending on your situation, it can change. So our waiting list is always kind of moving and evolving based off what's happening in everyone's lives. So right now, DDA only has funding. We're only funding crisis resolution categories right now. So Normally when I say that, I'll get a lot of parents kind of look at me like, well, I'm not in a crisis situation, so how can these services help me? There's kind of what I like to call, I don't want to call it a loophole, there's extra money put aside for what we call the Governor's Transitioning Youth Initiative, the GTYI funding. So these are services that are for people with a developmental disability, as defined in COMAR, as I stated before. So you are eligible for funding after your school eligibility. These are specially dedicated funds that are reauthorized each year by legislature. It is very important that everybody realizes that DDA is not an entitlement. So currently right now, if you have a loved one or a family member that you're taking care of and they have a developmental disability and they're in the school system, you are entitled to certain things based off of them having a disability. On the DDA side, you have to, it has to be a documented need. We do not give services just based off what you want. It has to be a documented need that this is something that you need. So again, it's you're leaving the land of kind of like entitlement and going into the land of eligibility. So I know I talked a little bit about coordinators of community services. If you are deemed eligible for DDA services, you will get what we call a CCS, a coordinator of community service. The coordinator of community services job is to, one, assess the person's wants and needs post-school. They're also going to coordinate and connect you to the adult service providers who will be providing those services. They'll help you identify providers, and they'll actually help you complete the paperwork for waiver enrollment. They will assist you with developing a person-centered plan. Your CCS is also going to monitor the implementation of that person-centered plan, that's that PCP, and your loved one and your satisfaction with services. They're going to coordinate the annual review and the PCP update. They're also going to advocate for the person and assist with self-advocacy. We do have a ton of people out there who can advocate for themselves. So your CCS, as I stated, we want to make sure that that person remains the center of the plan. So the CCS is going to definitely assist with self-advocacy efforts to make sure that he or she remains at the center of the plan. And they'll also assist with locating and implementing generic resources in the community. Generic resources would be things that are not DDA funded. If you need assistance with applying for Social Security, if you need assistance with Metro access, maybe you need assistance with camp funding, they do have access to other resources that are not DDA funded that may help you in the meantime of you starting services. So this is the role of your coordinator of community services, or CCS, as you'll hear. In Prince George's County, these are the CCS agencies that currently serve Prince George's County. It's your choice of who you want to work with. I know I mainly get asked, oh, who should I pick? Which one should I pick? It's really just based off your needs. They all have to follow COMAR regulations and things of DDA. So there's not one thing that you're going to get at one agency that you're not going to be able to get at another. So whichever one you pick is fine. It's just your choice of who you want to work with. Also, if things are not working out with your CCS, you're not locked in to those services. You can actually either switch coordinators within an agency, or you can change agencies altogether. And that's as simple as just sending us an email and letting us know that you want to switch. So as I stated, right here in Prince George's County, you can see the agencies. They are Beatrice Loving Heart, Medical Management and Rehabilitation Services, also known as MARS, Optimal Healthcare, Resource Connections, also known as RCI, Service Coordination, Inc., which is also known as SCI, the Coordinating Center, and Total Care Services. So after all of that, you're probably wondering, well, what options does my youth have to get into services? So DDA, we pay for the following. There are meaningful day services, and those are day and employment services. We also have self-directed services and support services. So I'm going to go in and briefly tell you about those. So under meaningful day services, under the day portion, we have 3 different programs that you can choose from. So there's day habilitation, and these are intended to increase independence, develop and maintain motor skills, communication skills, personal hygiene skills that would lead to opportunities for integrated employment. We also have community development services and their activities of special assistance. And these assist in developing the skills and social supports necessary to gain, retain, or advance in employment. Normally with CDS, they're in groups of 4. They can go into the community, do things of that nature, volunteer work, stuff of that nature. And we also have career exploration, which is a time-limited service to help participants learn skills to work toward competitive integrated employment. So from all of there, we also have meaningful day services under employment. You probably heard me say employment a few times on the first screen. So DDA, or Maryland, is a employment first state. We are not saying that everyone has to work, but we are saying that anyone who wants to should have the opportunity to. So what we're going to do is anyone who can work and get a job, we can put in the supports to help them. So under the employment side, there's employment discovery and customization. These are time-limited services to identify and develop customized employment options. Normally we have families that will come to us, or they'll come to a provider and like, we know they can work, but we're not quite sure maybe what they want to do. So what employment discovery and customization would do would kind of sit there and work to see what skills you may have and how we can hone those skills into a job. There's also discovery, which is a process to assist the participant in finding out who they are, what they want to do, and what they have to offer. So that's almost sort of like the same thing. We're going to just discover, let's see how everything like works, what skills you have, and then we're going to try to take those skills and turn those into employment. So once we figure out those skills, we have job development, and this is going to be supports with finding a job, including customized employment. So now that we've figured out what your skills are, what you're good at, what you like to do, what you don't like to do, we're going to look for a job that has, those major things with job development. Hopefully after that, they get a job, they land a job, and then we have ongoing supports. And these are various supports a participant may need to successfully maintain their job. There are some people that can do a job, but maybe, hey, they kind of need some redirection every hour. That's fine. We'll put in that job coach. We can pay for that job coach to be there to work with them to do all of that. And then we also have follow-along supports, which are periodic supports. So as much as we have people who work and may need assistance with kind of redefining the job roles, there are some people that once they get in there and they get that job, they're down packed, they're ready to go, and they only need follow-along supports. So maybe the job coach may drop in one time a week, maybe one time a month. It really is going to depend on that person. So why we have so many options. So these are all separate programs. So you had meaningful day services. There were 3 different options. And then under employment, you have these different options. They're all different options. Why that is because we do not want to do cookie cutter services for anyone. We want to meet your loved one where they are. So also if they are already going into employment, let's say sometimes there are people that come out of school and they already have a job. We're not going to make them start over. They're going to actually have their job, and then we'll probably do either ongoing supports or follow along support. So you can start anywhere in these and you can move around in these services. You're not going to be stuck in the same service for all your life. It just depends on what you want to do. So with the DDA, we also offer support services. These are services I like to say that can be added on to the day programs and the employment programs that I discussed. So here are just many different options. I will say that probably the most used option under here is the personal supports. So what personal supports is, generally our day and employment programs will go from 9 in the morning till about 3 in the afternoon. As someone who is caring for someone, you may say, hey, well, they can't be left alone. I'm not off work till 4:30. I'm fighting to get around the Beltway. I'm not even getting home till 5:30, 6 o'clock. What personal supports does is we can actually have a staff either meet your loved one at their program or meet your loved one at their home, and they can work with them on other goals until the caregiver gets there. So this may be organization in the house, cleaning, it could be cooking, or they can take that person into the community to do certain things. So, people who get services who have disabilities, they need their haircut, they need their nails done, they want to go to the movies, they want to do things like that. We don't pay for the activities, but we will pay for the body and the transportation to get them there. So maybe they have errands they would like to run after a long day, just like everyone else. So that's what that personal support staff can actually work with them to do. So as you can see from this list, there are a ton of different things. We do environmental modifications, someone who may need ramps, grab bars in the house, in the shower, things of that nature. So this is just a list of support services that we also offer. So you've heard of you've heard about our day programs, and you've heard about our support services. And there's sometimes still families that are like, my loved one really does not fit into any of those boxes. It doesn't work. I've had families tell me, like, the program starts at 9, it gets off at 3, but the problem with my loved one is if you wake them up before 11 o'clock, it's going to be a bad day. Understandable. We also have self-directed services. So this is a service delivery model where you would actually build your day around your loved one. With your loved one in mind, of course, we help you build a day around them. So you would be the employer of record. The person getting the services will be the employer of record. You hire, fire your staff, all of that, but you would build your day around you. If you didn't want your day to start until 11, then it doesn't start until 11. If you have someone who, hey, maybe they want to do something different than what's offered in the traditional program, that's fine as well. So self-directed services, DDA would provide a budget, and then you would have to pay the staff out of that budget and make that work for your loved ones. But you can actually all just build your own day around them. So those are our self-directed services. So as I stated, there are many different options because we don't want to do cookie cutter services for anyone because everyone is different. Right here is an approximate timeline of a person's transition year. With DDA, we are aware that a person can stay in school up until the age of 21. So DDA services generally begin after your loved one has met all of their school eligibility. So the summer before your transition year, I'm going to use the people who are graduating in 2022 as an example. The summer before the transition year, which would have been June and July of 2021, they're visiting providers, they're looking at providers, contacting providers, seeing maybe who would be a good fit. Generally in the fall, which would have been around October, November of 2021, you turn your choice letter into your CCS and say, hey, these are my top 4 choices. Your CCS is going to follow up with the provider to see if you've been accepted. The same way you pick a provider also has to pick you. We want to make sure that health and safety are definitely something that's being talked about. So there are some times where you can pick a provider, but the provider may say, hey, we are unable to service that person. So we ask that you at least visit for providers so that your CCS has a list to work with. Generally in February or March, which is around the time right now, CCS are going to start enrolling people into the waiver. These are waiver services. So the CCS will complete all of that paperwork. They'll just need documentation from you, but your CCS is going to complete all of that. And then July 1st, and this would be July 1st of 2022 for the people that are graduating in June, that'll be the earliest start date for services. So at DDA, we have different DDA waivers. So we have the family supports waiver, and they service children birth to the age of 21. And in that waiver, we're all, you can receive any of the various support services. So like the home modifications, the personal supports, anything of that list that I talked about. In the community supports waiver, it services children and adults. It has all of the various support services, but now we're also adding those meaningful day and employment services that I discussed. So the CDS or the employment, discovery, anything of that nature are added to that. And then we also have the community pathways waiver, which services children and adults. It has all of the support services in it. It has all of the meaningful day services in it. The only difference is we also include residential services in this one for people who would need a residential service. So those are the 3 different DDA waivers. I always stress to families, don't worry about what each waiver has to offer or anything like that. I just say, you let us know your need, your wants and needs, and we also make sure that you get into the right waiver. I think sometimes families get caught up on the waiver, like, well, I want to be in this one, I want to be in that one. Let us know where, you just let us know what we're doing, and then we'll pick the waiver. But please note that as needs change, we can change your waiver. You're not stuck with that either. So there are some times where we've had people in the community supports waiver and sorry to say, but like a caregiver may pass away and now they have nowhere to go. We'd move that waiver and get them into the community pathway so that they can go into residential. So we definitely make sure that as your needs change, we understand that your waiver may change. So I am going to take questions, but I just want to give my information right here. If anyone has maybe a personal question that they want to ask me, please feel free to shoot me an email. Anyone who is not aware of like, hey, I think I applied for DDA, I'm not sure, please shoot me an email. I can look that up. If you've applied for DDA, like I know I applied, but I haven't heard from anybody, shoot me an email. If you don't know who your CCS is, shoot me an email. But I know right now, I think we're going to do some general questions. But like I said, this is my information. It's just Nicole, NICOLE.Sheppard, SHEPPARD at Maryland, and that's spelled completely out, .gov if you have any questions. So I'm going to go ahead and stop sharing my screen. And if there are any questions, I am here to answer them. I know that was a lot of information I just gave you, but if you have any questions, let me know.